For stroke care, time is brain. And once you have permanent injury to your brain, you can't get it back.
If you can get to us within 2 minutes, your outcomes are going to be better than if you wait 2 hours. I'm Dr. Albert Cook, the head of neurology here at Emory Johns Creek Hospital. For the vast majority of people that have a stroke, we divide it into two parts. It's either due to lack of blood supply to a particular part of the brain or a hemorrhage in a particular part of the brain. They're going to be branched into either what we call ischemic or hemorrhagic. Important to differentiate between the two types. The treatment options are different depending on what kind of stroke you have. If you don't appropriately identify the kind of stroke you have, the treatment you render may in fact be harmful.
People in the Johns Creek community should feel very secure knowing that they have a certified stroke center right in their own backyard.
Emory Johns Creek Hospital has been certified by the Joint Commission as a primary stroke center.
Everyone has had specialized training and is highly aware and highly sensitive to how important time is of the essence.
During the training to become a stroke center, everybody, not just myself, not just the neurologists on staff, but the hospital doctors, ER doctors, nurses, even the janitors have some modicum of training in recognition and response to possible stroke. The patients in the North Fulton and Gwinnett community should feel very comfortable that they can get very high-end stroke care in a very timely fashion in a local community and not have to worry about the time lost traveling to another facility.
So it is critical that you come in immediately when you think you have symptoms of a stroke.
Some of the typical symptoms for stroke include weakness on one side, sensory loss, numbness on one side, visual changes happen on frequent occasion, problems with walking that are acute in onset. People have problems with their speech, specifically with their language, but even the mechanics of speech can be altered.
Do not drive, call 911. They can put us on alert, and again, that can expedite your care even faster.
The neurologist is made aware of your arrival as soon as the ER is made aware of your arrival. There are times when I know a patient's going to show up in the emergency room with a stroke before they show up in the emergency room with a stroke. So if the emergency room calls, it's frequently the case that I can come right out of my office, which is right here on campus, not just discuss the patient over the phone, but see them live and in person and help the emergency room to differentiate one stroke type from another, review the findings that have been gathered by the emergency room to date, and then make the appropriate decision based on those findings.
The teamwork is critical. We all work cohesively together to make sure everyone knows their part and everyone takes part in providing the utmost care in the timeliest of manners.
Having the hospital here in the Johns Creek community should give the members of the community that sense of comfort that coming to the Emory Johns Creek campus will provide them with timely, competent access to stroke care that is second to none.
I'm Dr. Arthur Griffiths. I'm proud to be a member of this team here at Emory Johns Creek Hospital, your certified stroke center.